How can cystic fibrosis diagnosis be improved upon?
So there are tests which can test only that part of the gene which is causing cystic fibrosis. That is called uh, targeted sequencing. So there is one higher version that is called a newer generation sequencing, in which there is a targeted sequence of the CFTR gene, and that costs less as compared to the whole exome sequencing. So for testing genetic tests, one is whole exome sequencing, another is targeted, that you want to target only particular gene, and the third thing is clinical exome sequencing, in which similar clinical symptoms are there, and you are not very sure whether I am dealing with the cystic fibrosis, primary ciliary dyskinesia, primary immune deficiency. In those situations, you can go for a whole exome sequencing, or if it is very clear that the earlier sibling has died of cystic fibrosis, you can do a targeted sequencing for the cystic fibrosis alone. But otherwise, best thing would be to do a sweat chloride along with clinical symptoms, and that helps in diagnosis of cystic fibrosis.